Let me take you live to Adelaide now. The Prime Minister, Anthony Albanese, is speaking.
There will be able to be 100 patients supported by this service and facility every day at any time. But importantly as well, what it will train is 1,300 health professionals a year. So this is a great example of the government working with the university sector to make sure we address two things. One, it provides people with more access to immediate health services, but at the same time, we're building a better future by training more people for these facilities. More than 490 nurses, 250 social workers, 128 occupational therapists and speech pathologists, more than 100 paramedics, 60 physios, more than 50 midwives, 24 clinical psychologists, 180 other allied health professionals. This is a comprehensive plan going forward. It comes on top of the investment that we made at the last election campaign to upgrade Flinders, and you could see that infrastructure work underway, nearing completion as we came in here today. It is absolutely vital that at this election we strengthen Medicare rather than undermine it. And one of the things that we have done with the combination of measures, with the investment that we're having in hospitals, the $1.7 billion of additional funding we've put into public hospitals this year, with our support for urgent care clinics, the 87 we've opened, the 50 additional ones that we will open, with our tripling of the bulk billing incentives so that more Australians can see a doctor for free, and with our cut in the price of medicines down to $25, the same price that they were in 2004. What we're doing with all of this is making sure that this little green and gold card that represents Australian values, what it represents is a card that says, if I get sick, if I need health care, I'll get it, regardless of my income, regardless of my status in life. Every Australian's entitled to that. It stands in stark contrast to the American system that simply doesn't get that. It stands in stark contrast as well to the alternative vision. We know what Peter Dutton thinks about health, because when he was the health minister, we had $50 billion cut from hospitals. He attempted to introduce a tax every time people visit a GP and therefore abolish bulk billing altogether. He attempted to put in a tax every time people visited the emergency department of a hospital, and he introduced legislation to try to increase the cost of pharmaceuticals by $5. With his $600 billion nuclear plan, cuts are going to have to come from somewhere. And we know from past experience, health and education are the two areas that will begin. So this election is about a choice between Labor, strengthening Medicare, supporting cost of living relief, building a stronger economy and building Australia's future, and a coalition government that wants to cut everything except for your taxes. The Premier.
Thanks, Prime Minister. Well, thank you so much, Prime Minister, for your commitment that you've announced here today. I remember distinctly standing with you about 3 years ago when you announced a largely unprecedented commitment to a public hospital here in South Australia, a $200 million commitment from the federal government to match the state government's funds to dramatically expand the Flinders Medical Centre, one of the busiest hospitals in the nation. And since then, the commitment has only grown. And as we speak, right now, Flinders is undergoing one of the biggest transformations it's ever experienced during the course of its history. What is now a $498 million expansion of the hospital to build more capacity. And that is what I guess I am so grateful for more than anything else, is to have a federal government that understands that in this country we've got a growing population and an ageing population. So now is not the time to be cutting investments in health. Now is the time to be making them. And to have a government that is serious about making sure that every last Australian is able to get access to high quality health care in a first world country is mission critical. I'm very appreciative of indeed. This $150 million investment, on top of the $150 million coming from Flinders Uni, will see 1,300 people get trained extra each and every year in the critical services that a hospital needs to function. More nurses, more doctors, more allied health professionals. So we're building the beds, and now you're helping deliver the workforce. And that will mean more people getting seen to on time to get the best possible healthcare that money can buy in a country as rich and as wealthy as ours. And that is us living up to that egalitarian ideal that no one gets left behind, particularly in the most urgent time of need. As a Premier, I can't stress enough that we want a Prime Minister of this country who understands that people need to have public health care invested in. Now is the worst possible time. I could not think of a worse possible time to have a Commonwealth government that would be actively cutting health when we need to be investing in it. So to that end, to you, Prime Minister, we have a partner that we are very, very grateful for in the South Australian government. It's a partnership that is making a big difference on the ground in healthcare service delivery, and it's one that we want to continue for a long time to come. So our thanks is genuine, and we look forward to your re-election in a few weeks' time, all being well, to make sure we can get on with the job.
Well, thank you, Premier, and thank you, Prime Minister, and to Louise as well, and to the wonderful staff, the doctors, the nurses, the midwives, the staff here at Flinders Medical Centre who have been serving the southern suburbs of Adelaide for 50 years. They really have. And the $200 million commitment, which is now up to $249 million commitment that Commonwealth made 3 years ago, like yesterday's announcement in the northeastern suburbs of Perth, is a strategic investment in a critically important hospital asset for our national healthcare system. This is one of the 3 big quaternary hospitals in Adelaide. It is 50 years old. It needs the investment that the Malinowskis government and the Albanese government are putting in to renew it and ensure that it can continue to serve the needs of the southern suburbs for the next 50 years. It was just great to talk to a number of the recent RN and midwife graduates from Flinders University, Colin Ure University just then, who are doing their first year placement here at Flinders and looking forward to a wonderful career in South Australia's healthcare system. We're providing them with support with paid prac for the first time, RNs and midwives, to support them doing this really important but often quite challenging period of practical placement for them. And in addition to our focus on bulk billing, urgent care clinics and cheaper medicines, building the health workforce is the 4th critical pillar of our strengthening Medicare agenda, and that's what today's announcement is all about. Yesterday we announced a new medical school in Queensland to be delivered by QUT. We're delivering the first medical school in the Northern Territory, at Charles Darwin University, complementing some terrific work that Flinders Uni has done for years, training medical graduates in the Territory. We've allocated funding for 150 additional Commonwealth-supported places in medical schools to be rolled out over the next couple of years. The first big injection into medical schools for more than a decade. We've got to build our workforce. And so those numbers the Prime Minister went through are just critically important to ensuring that this terrific hospital has the number of graduates it's going to need. And Noarlunga Hospital and other services in the southern suburbs will need to service the needs of a growing population that is getting older and is getting sicker with more complex chronic disease. So this critical announcement, our 4th really important pillar of strengthening Medicare. But I want to say to those nurses and those midwives that this is a government like the Malinowskis government that has your back. Last year we delivered every single one of you a tax cut when the Liberal government's tax cuts were only going to go to some. And this year, last week, we've legislated top-up tax cuts over the next couple of years so that an average worker over the course of our tax plan will get $2,500 in tax cuts. Last year's plan was opposed by Peter Dutton. The legislated tax cuts from last week will be repealed by a Dutton-led government. He's made that promise. Your tax rates will go up under a Dutton-led government. That's our first commitment to you. But also we want to make sure the hospital system is better supported. That's why we're supporting this investment at Flinders. It's why we committed $43 million to the South Australian government last year to help ensure that older patients flow more smoothly and more quickly through the hospital system, alleviating that pressure of bed block that I know the Premier and Minister Chris Picton have been so worried about here in South Australia. But it's also why we will deliver a record increase in the coming 12 months to the South Australian hospital system. The Commonwealth's contribution to South Australia's hospitals next year will be 15% higher, an injection of $300 million additional dollars into supporting the amazing work that doctors and nurses do here, all in addition to the way in which Medicare urgent care clinics are alleviating pressure on this emergency department, among others. Contrast that with Peter Dutton's record on hospitals. As the Prime Minister said, as Health Minister 10 years ago, he wanted to rip $50 billion out. That would have meant $4 billion taken out of South Australia's hospital system over a decade, where all of this growing population demand, ageing of the population and so much else has placed real pressure on this hospital system like every other in the country. $4 billion he would have taken out. And he'll do it again. He told you, judge me on my past performance. Well, I am judging Peter Dutton on his past performance. The worst health minister in the history of Medicare. He'll rip money out of hospitals, no surer thing the night follows day. He'll rip money out of Medicare. He'll go back there to pay for his $6 billion nuclear power plant. And extraordinarily, over the last 24 hours, he's confirmed again that they'll go back to the schools budget. That's what they did in 2014 again. $50 billion out of hospitals, $30 billion out of education. He's going to do the same thing again, but it will be even more ideological than it was back then. He said very clearly to schools, if you don't line up with my personal political views, you'll lose funding. The most extraordinary thing I've heard from an alternative Prime Minister in this country. Well, under our Prime Minister, you'll get lower taxes and stronger Medicare. Under Peter Dutton, you're going to get higher taxes and a gutted Medicare.